So today we are going to talk about hyperkalemia. If you guys can see, this is the serum potassium. The normal value is 3.5 to 5.1, or we can say 3.5 to 5.5. If you guys can see my book, The Resident Physician Treatment Guide, I had explained the hyperkalemia properly in this one page. And I also explain about the serum potassium level with ECG changes, and then I put overall treatment in this one page. So let us explain properly. Hyperkalemia means when the potassium level is more than 5.5 and the normal value is 3.5 to 5. 5.5. Now when the symptom will be occur, when the serum potassium level get more than 6.5 milliequal per liter, then the symptom will be started. The symptom are muscle weakness, paresthesia, bradycardia, cardiac arrhythmia, and arrest. When the patient having renal failure and bradycardia, think about hyperkalemia. Now what will you advise? So we will advise serum electrolyte, renal function test, and ECG. And serum electrolyte we will look for serum potassium, and RFTs we will look for the renal failure, and ECG we will look that for the ECG changes. If the potassium is level is from 6 to 7, then tall T wave. If the potassium level is 7 to 8, then loss of P wave and widening of QRS. And if the potassium level is from 8 to 10, then we having sine wave. And if the potassium level is more than 9, then patient will be having ventricular tachycardia, atrial fibrillation, and cardiac arrest. So now let us talk about the treatment. Now, the first treatment is that we have to stabilize the cardiac membrane. For the stabilization of cardiac membrane, we will give the injection which is called calcium gluconate. If you guys can see here, this is the calcium gluconate injection. This is 10%, 1 gram per 10 ml in 100 ml normal saline IV over 10 minutes. So we will give it IV over 10 minutes. This is for the cardiac stabilization. Now the second treatment will be shift the potassium into the cell, like infusion dextrose saline 25% 100 ml plus injection insulin regular 10 unit IV over 30 minutes. Now let us explain this. This is called D-potash. So the D-potash in hyperkalemia, what does it mean by D-potash in hyperkalemia? It is like this is 25% dextrose saline. We will take the 100 ml up to 25% dextrose, and we will put in the 100 ml burette, and then we will also add the 10 unit of insulin. So we will add the 10 unit of regular insulin in this, and then we will give IV over 30 minutes, or we can say IV at the rate 50 drops per minute, and then we will repeat the ABGs or serum electrolyte will look for potassium. Then we can repeat this D-potash. Another thing we will give as a nebulization, that is salbutamol nebulization. If you guys can see here, this is the salbutamol 20 ml, and 1 ml is equal to 5 mg. So we will take the 2 ml of salbutamol or 2 cc or 2 ml of salbutamol plus 4 cc of normal saline, and we will nebulize the patient for 5 to 10 minutes. Now another treatment is K-binder, that is we call K-strain sulfate sachet 15 mg. We will give it in TDS, and for potassium excretion we can give injection Lasix furosemide. So this is the treatment for hyperkalemia. But the most important thing in the treatment for hyperkalemia, that is stabilizing the cardiac membrane with calcium gluconate, and shift the potassium or D-potash the patient with the 25% dextrose and 10 unit of normal saline, 10 unit of insulin. Thank you.